Welcome to eqcares YouTube channel for another eQ&A Live. My name is Dr. Rachel Goodman. I'm a clinical psychologist here at eqcare, where I'm now practicing from home full-time. At eqcare, we are ready to help Canadians with their mental health concerns. If you're looking for more information, head over to the new eqcare.com. On this eQ&A session, I want to provide some advice for managing our mental health as we start leaving the house a little more. As always, in these sessions, we will not be discussing COVID-19 symptoms or treatments. I'm not a physician, so we will leave those discussions to the public health officials and medical professionals. Instead, today we're going to keep our focus on mental health and well-being. As well, we've asked our friends, colleagues, and family members to submit questions to us via email at eqcares@eqcare.com. You can send us questions there too. But we'll also be taking questions live. If you have any, leave us a comment and we'll try and answer as many as we can today. It can seem like a bit of a scary time right now to leave the house. The pandemic is still ongoing and public health advice continues to evolve on the best ways to stay safe. It's not unusual to feel anxious when you leave the house. Today, I want to talk about some of the things that you can do to keep calm and focused, to not get too overwhelmed when you go out for groceries or to the pharmacy. It's important to get out of the house. Locking yourself away is only going to exacerbate any existing anxieties. Let's remember, of course, that we are assuming here that you are not experiencing any symptoms of COVID-19 or have not been exposed to anyone else who has tested positive. We're going to start by talking about anxiety during COVID-19. Most importantly, as we begin, we should point out that everyone is experiencing stress these days, and that is normal. You don't have to suffer alone. I, for one, have found that in the past week, things have been harder for me. It's been 9 weeks that we're stuck inside, and I'm going a little stir crazy, I must admit. There's been a report from CTV News. Can-do attitude gives way to anxiety, despair for many. It recaps some of the more common burnout issues associated with this pandemic. The novelty has worn off, and it seems that the optimism and resilience that we were feeling at the beginning has literally been depressed. The interviewers took some information from an Angus Reid survey. By the way, soon on eqcare.com, you'll see our own Angus Reid group survey, which includes results on mental health. Let's go through some of the issues that this poll found. That feeling of togetherness that many of us were feeling at the beginning has been replaced by uncertainty and feelings of isolation. Half of Canadians in the survey reported a worsening of their mental health. They found significant feelings of loneliness, which is a huge risk for mental health issues as well. In terms of depression, 10% of people say it's worsened significantly. Suicidal feelings are also going up, with support lines reporting significantly more calls, some by a 30 to 50% increase. Feelings related to uncertainty about the future are very common, the poll found. We've been seeing people react in impulsive ways, snapping at family and friends and even strangers on the street. I find myself a little less in control of my own emotions when something small sets me off. We are a society that rewards impatience. We want everything now, like ordering Uber Eats or Amazon Prime. We're not used to having to deal with uncertainty and not knowing when this will all be over. People do need some direction about what is okay and what's not okay when the restrictions start to be lifted. People are wondering, is it okay to go to the grocery store? Is it okay to go out for a walk? Personally, I'm finding watching others on social media post about all the incredible skills that they have gained kind of anxiety provoking. If you just manage to take care of yourself and those that you love around you, you need to know you're doing a good enough job. I read an article called The 10 Sneaky Ways That Your Coronavirus Anxiety is Coming Out. And these are them. You may feel more tired even though you're doing less. You may not be sleeping well. You might find that you're startling more easily. You may be channeling a lot of energy into your hobbies and activities. Like I mentioned before, we're seeing an excessive enthusiasm or extreme productivity, which might be your coping mechanism or how your anxiety is presenting. People are showing lower interest in their usual activities, which is known as apathy. People are experiencing intense loneliness. We've also seen a reactivation or agitation of previous mental health conditions. You may be having more headaches or more physical symptoms. You may feel angry often or have frequent outbursts, and you may find that you're forgetting things. While stay-at-home recommendations might feel like holidays for some people with social anxiety and other disorders, staying home entirely can really make anxiety worse. It's very important that you keep a schedule. We've said this before, but it's important to reiterate. Even if you're not working, even if your kids are not in school, we need to try to maintain a schedule where you wake up at approximately the same time every day, go to bed at approximately the same time every day, and have meals, regular meals, not snacking all day, get dressed. As long as you're not supposed to be isolating, get outside, because that is a must. And getting active while doing it is even more important, whether it's traditional exercise that you're doing, walking, running, etc., or other things like gardening, house projects, cleaning out your garage. You don't need to go get overwhelmed by projects. You can break them into smaller chunks and every day or every few days do something. The importance of communication is so really huge. We can't understate it. If you can have visual communication and connection with people, whether it's actually in person, going to walk to a friend's and staying at the sidewalk and talking to them, assuming that you're allowed to do that where you live, or at least on FaceTime or video, that's ideal. And if not, at least to speak on the phone or text with people, we need to make sure that we're not isolating ourselves. If you can check on someone else too, that can even make you feel better. A lot of us are feeling a loss of control, and that's for good reason, because there's so much out there that we cannot control. But rather than focusing on what you cannot control, try to focus on what you do have control over, your reaction to the situation. For example, the absence of traffic on the street can be unsettling, or it can be an opportunity to revel in the peace and quiet and the ability to hear the birds sing. You really want to be kind and compassionate to yourself and to others. Remember that that person 2 meters away is in the same boat as you. If you see someone out that looks like they're doing something wrong, you don't have to assume the worst. I've seen people screaming at other people on the street for talking to somebody or coming too close, and it turned out that that person was going to a family member that was sick and that they had no choice but to help out. So we want to be compassionate. For those who already have disorders like OCD, which is obsessive compulsive disorder, COVID-19 presents the possibility of a large setback on any progress that they may have made through their therapy or other interventions. I read a quote from an OCD sufferer in an article which said, "Suddenly everything that I told myself again and again until I believed it was true is in direct contradiction to what my boss, the government, and the community were telling me." So these are very confusing messages for people who have been struggling with obsessive compulsive disorder or health anxiety, where they've been trying to tell themselves, no, these thoughts are wrong. And now everyone's telling them that their thoughts are right. Uncertainty is the basis of all anxiety disorders. So in some ways, COVID-19 has set a fire to the foundation of anxiety. A counselor at the Anxiety Treatment Center of Greater Chicago has said. Some people are feeling validated, though, by knowing that others now understand to a degree what they have been going through for so long. And I've spoken to some of my clients who feel understood now by their family because their family members now get it when they say that they've been feeling depressed or when they say that they've been feeling anxious. They can now relate to what those feelings feel like. Others, however, feel terrified that the people that they look to for examples of good health are now falling apart. We have some questions from our community that came in advance. Is it normal to experience heightened anxiety right now? The answer is a resounding yes. We are all experiencing more anxiety across the board. Of course, if it's at a point where it's not intolerable, where you can't manage it, where you can't find ways to help yourself, then that may be something that you need to go for help. When do we know if our anxiety is becoming a problem or is normal for the time? So that's a fair question, kind of related to what I was just saying. I think that if you are able to talk it out with somebody, you're able to use a mechanism like a breathing technique or a mindfulness exercise or go for a walk and find that the anxiety decreases, at least temporarily, and you're able to manage it, then that is okay. But if it's overwhelming you and you cannot function, you can't accomplish anything in your house, you can't carry on a conversation, then that's something that needs to be addressed. How can people with anxiety stay calm as the pandemic goes on? So that's a good question. And I would say that for those people who have been in therapy already, they know what to do, and they just need to remember to use their tools, which are stress management tools. And for those people who this is new for, experiencing anxiety, there are so many free resources out there. Therapists who are now working virtually so that you're able to see them and you can reach out for help. But you can go to your local order of psychologists and look online. You can look at the Canadian Psychological Association, American Psychological Association. Google different websites that are reputable and see articles about how to help yourself. There are tons and tons of apps now that are being offered for free for mindfulness and breathing exercises, and you can manage that way. And really, it's very important to talk about your feelings and share them. Don't hold them inside and be embarrassed, but reach out to others and see if they're feeling the same way. I'll bet you'll find that they are. Are there ways to keep up with the momentum with treatment while the pandemic threatens to undo it all? I assume that question is referring to the momentum of therapy, if you've been in therapy before. And if that is what the question means, what I'm going to say is, yes, every therapist that I know is now working online, whether it's virtually by video, if you have the capacity for that, or even by phone. And many are offering reduced rates. And as I said, the government of Canada and the United States has offered free services. So there is a lot out there that's available. And it is challenging sometimes to find a time where you can have your therapy session privately, because you have your whole family home now if you live with other people, and it's hard to find a private time to speak. But most therapists are flexible and will be okay with you going for a walk or going to sit in your car and doing your session there. We're going to move on to another topic, which is when coronaphobia becomes agoraphobia. So a lot of people are feeling afraid to leave the house, as we mentioned at the beginning of this video. This is an issue that's been explored a bit in media. Can anxiety over COVID-19 become so severe that it becomes agoraphobia? So let's first go over what agoraphobia is. Derived from the Greek term for assembly or gathering space, agoraphobia is the fear of certain public situations or places, especially when there is no easy escape. A poll in the UK revealed that a majority of Britons are nervous about leaving their homes, with public transport, bars, restaurants, and mass gatherings like sporting events triggering the most anxiety. After weeks of sheltering at home and adapting to a new normal, many people are finding that leaving the house is a particularly worrying prospect. The act of stepping outside their front door is no longer an unconscious one. Instead, they're feeling anxious about the idea that leaving the safe bubble that they've created at home over the past couple of months. The type of anxiety that people without pre-existing agoraphobia or a predisposition to this condition are experiencing is more similar to what we would usually call it social or health anxiety. The anxiety that people with agoraphobia experience stems from an intense fear of not being able to escape from a difficult or embarrassing situation, or get help in the event of a panic attack or panic-like symptoms. However, the anxiety about leaving the house that many of us are feeling now instead stems from a fear of COVID-19 and what's going on outside might mean for our health. Indeed, The anxiety that people with agoraphobia experience is different. And I think that we need to recognize that likely most of us are not really afraid to leave the house because we're afraid that we're going to behave in an embarrassing way, but we are afraid, and perhaps rightly so on certain levels, of what's out there. And we have to kind of find the right resources and the trusted information, and trust our public health officials that they are going slowly enough in opening up and lessening the restrictions. But also, if you yourself don't feel comfortable going out, you have to respect your own feelings. I'm not suggesting stay at home, try to go slowly, but respect if you need to go more slowly than other people, that's okay. We have some questions from the community on this topic. How can people tell if their COVID-19 anxiety is becoming out of hand or close to agoraphobia? So I think that, as we said earlier, it's really about, are you restricting yourself from going out at all? And I think most of us have been leaving the house at least to get some fresh air on the front of our house. Or if we live in an apartment building, it may be more challenging, but at least going out to the balcony, not staying inside completely. It's really, really important that we do get that fresh air for our mental health, that we do get outside and experience the world, obviously in safe ways. How can agoraphobia be treated? And can agoraphobia be a permanent condition? So people who do suffer from actual agoraphobia, yes, that can be permanent in the sense that it's something that they struggle with, but there are very successful therapies for agoraphobia, actual agoraphobia, where people are afraid to go out of their homes because of their fear of shame or being embarrassed by their own behavior. And sometimes it's about enclosed spaces. People don't want to go to certain places. And there are very successful treatments within cognitive behavioral therapy that do work for that, and something that you could explore. We're going to move on to the next topic of getting back to normal. And I don't know what normal means, but we're going to talk about that. Here at eqcare, we're preparing employers for the return to work, but there's no getting back to normal. Extreme patience and new precautions will be necessary, and it's crucial that we all become more conscious of workplace mental health. It's a great opportunity to take better care of ourselves and uncertain times when even our public health authorities don't have all the answers. Here in Quebec, plans to reopen have focused on some sectors more than others. The province has had to delay some plans as the situation changes and pushback comes from the public. So as many of us know, the Premier had planned to open up schools, and some schools did open and the rest were supposed to open on a different day. And then he went back and changed his mind and decided, no, none of these kids are going to school until September. So I think that was based on obviously public health decisions, but also the fear and anxiety of the public in terms of sending their kids back to school. The anxieties about Legault's timeline are not evenly distributed. Certain business groups whose members have been idle for weeks are naturally keen to get their economy moving again. What accounts for these varying levels of anxiety of different businesses? One factor might be how much input different interest groups had in the drafting of the government's plan. I understand, and I'm no expert, that some businesses were more involved than others in terms of making those decisions. And some of those businesses felt very left out in terms of having the government allow them to have their input. Challenges will remain as businesses open, and the typical workplace will look very different following this pandemic. There's no question. Infection precautions such as taking each worker's temperature on arrival, providing face masks, keeping workstations at least 6 feet apart, and wiping down surfaces are things that could make everyone feel safer and less anxious. Physical and mental health, as we know, are closely intertwined. And when you practice good hygiene and physical distancing in your office, you should also practice stress reduction, says Bernadette Melnick, the Dean of the College of Nursing and OSU's Chief Wellness Officer. So people are really thinking about what it will look like to go back to work and how it needs to look different than it used to. Let's talk a little about some tips on boosting back to work health. This is from WebMD. Eat at least 5 fruits and vegetables every day. Don't smoke and limit your alcohol intake to 1 drink a day for women and 2 for men. Be sure to follow recommended safety precautions. These include washing your hands frequently, keeping sanitizer and disinfecting wipes handy, and cleaning surfaces often. You can wear a mask and don't shake hands during meetings or when interacting with customers. You want to avoid crowded conference rooms and keep your workspace at least 6 feet from your nearest coworker. When possible, employers should allow employees to work from home or stagger in-office shifts. If a COVID-19 vaccine becomes available, be sure to get the shot. A U.S. advice columnist with the Philadelphia Inquirer named Elizabeth Wellington offered some good back to work tips that we can get behind. First, she says that our anxiety is threefold. We are mourning the loss of our past lives, especially the idea of not being able to safely hang out with friends at restaurants, clubs, or at concerts. We have no idea what our future will look like, especially our workplaces. How will we get there? What will our offices look like? And what happens if we emerge from our carefully constructed bubbles and get sick? And we're still scared of getting sick. Frontline workers have even more concern, obviously. With exposure to more people, they are more likely to be affected. Just in terms of the comment about mourning our past lives, 2 days ago, the Premier in Ontario announced that sleepover camps will be canceled, and my kids go to camp in Ontario, and it was a huge loss for us. My children were crying, and I cried with them. It's something that, although we once again know that we're very lucky that we are safe in our homes, that we have food, we have a roof over our heads, we have our health, and we're very fortunate as compared to some other people. These are real losses for many of us, and they need to be respected. So back to Elizabeth Wellington's tips. Here are her tips for going back to work. Let's go through them. Control what you can. You want to continue with public health measures, hand washing, wiping surfaces, masks, and distancing. You want to let go of what you cannot control. Don't focus on the person in front of you who's not wearing a mask because you can't change that. Instead, focus on the present. Be grateful for what you have and what you are able to do to keep yourself safe. Wait and watch. Know your boundaries, as I said before, and don't rush back. If you yourself cannot tolerate it and you are able to ask your boss to work from home and that makes you feel more comfortable, then go ahead for the time being. And very, very important, maintain your self-care regimen. So even if you are going back to work, we need to remember it's more important than ever to be taking care of ourselves. And whatever it is that you implemented, hopefully you did, during this time to take care of yourself in terms of physical exercise, mental exercise, self-care, stress management strategies, connecting with others, you need to continue to do those. Some more questions from our community. As public health advice evolves and people are going out in the world and back to work, what are some of the best ways to manage feelings of anxiety? So as we just said above, and I think she gave us wonderful tips, we want to control what we can and only focus on that. And it's very easy to get caught up on all the things that we don't have control over. But it's about shifting your thinking and recognizing what you can control. And then again, taking care of yourself and the people around you physically. How can we talk to clients or colleagues or even bosses if they don't respect social distancing recommendations? So I think that's a tough question, and I don't know that I have the right answer, but I'll try to answer it. I think that if you say it in a respectful way, to say, this is what I'm doing, I need to distance myself. This helps me to feel more comfortable and not get angry and snappy at that person for not doing it. Perhaps they may not follow the rules, but you can continue to try to step back and do what you can. Am I right to be angry with friends at work who are getting into my personal space? So again, I think that there's a question of, are you right to be concerned about it? Very possibly, based on the public health recommendations. Are you right to get angry? I think we have to watch our anger, and most of us are really feeling tense and on edge, and we have to find ways to manage that, because we can get ourselves into trouble with getting angry with colleagues and bosses, and that's not going to help you when you go back to work. How can parents help their kids feel less anxious about going out in the world? So it's a fair question. I think kids are pretty resilient and they bounce back pretty quickly if we show them examples of us doing those things. So obviously we don't want our kids being too laissez-faire about going out and not distancing from their friends and doing things that are not legal or are not safe. But if we want our kids to start going out, we need to take them with us. I wouldn't take them to the store right now, but go for a walk with your child. Show them that it is possible to leave your house, to go for a walk, but to maintain distance from other people. Now we have some other general community questions. If I'm feeling suddenly anxious when I'm out of my house, are there things I can do to calm down? Yes. So first, I think if you notice that anxiety, that's wonderful. And the first thing I would say is stop and breathe. There are different breathing exercises. I tend to teach people a breathing exercise where the inhalation is through the nose, and you want to breathe in through your nose for about 4 counts, hold it for a second, and then stretch out that exhale through your mouth as long as you can, because the physiological relaxation comes from the exhalation. And I would encourage people who are feeling anxious not just to do that in those moments when they're feeling anxious, but actually as a prevention technique, kind of like brushing your teeth twice a day. So if you wake up in the morning and start your day by breathing, and you end your day by breathing, and you don't have to do this for long, it can be for 2 or 3 minutes, but if you love it, you can do it for longer, 10, 15 minutes. That can physiologically relax your overall system. In addition, as we said before, there are many apps of mindfulness. So if you were practicing that and you found yourself outside feeling anxious, you could practice some mindfulness. Mindfulness, in essence, means being present in the moment without judgment of yourself. And it does not mean clearing your mind completely to have absolutely no thoughts, but it does mean focusing on the present moment. Those are a couple of tools. There are many others. I find other people to seem scary now because of the pandemic. Should I be scared of people, or are there ways to change my thinking to not be so fearful? So, yes, we should not be afraid of other people. I understand that there is this notion that other people could be carrying something that can make us sick, but generally, we do have ways of protecting ourselves to not get too close and infected by that person. And the reality is not every person out there is carrying the virus. So it's important for us to be able to connect with people that perhaps make us feel comfortable to start off with. And you can start that way by practicing seeing, speaking to, spending time in a socially distant way with people that already make you calm, and then practice going out with people that you don't know and perhaps you don't have that same experience with. As I've grown tired of being in lockdown, how can I get back some of the optimism of a few weeks ago? That is a great question. As I said earlier, I'm feeling a bit weary and worn down by all of this. And what I'm trying to do is take it day by day. And it's very easy to get caught up in, oh my goodness, are our kids going to go back to school in September, or are they still going to be online? Are we going to be able to celebrate the holidays with our families, which is far off, but maybe not so far off? How long are we going to live like this? Are we ever going to be able to go back to work fully? And we can get caught up in those things that, as I said before, we don't have control over. But what you can control is, what am I doing today that's going to make me happy? What am I going to do tomorrow? Can I make a plan to see or speak to a family member or a friend tomorrow? I can only say that where I live, we have a new restriction lifted. And as of tomorrow, 10 people, maximum 10 people from maximum 3 families can get together in a socially distant way. And I think it's important, if you can, to take advantage of that. So this weekend, make a plan to see another family and get together in the backyard and have that human interaction. Again, it has to be allowed in the place where you live. Keeping a routine is getting difficult. How can I keep up my discipline? So that's a good question. At the beginning, some of us were able to say, I'm going to be disciplined about this. And then when it lasts so long, it just seems very hard. I think that we need to view the schedule as something that is just an urgency for your mental health. And if you show that to your family members and kids, they will follow suit. So get yourself dressed every day in some level, and find certain things when you're talking about discipline of schedule that actually give you joy. It doesn't have to just be about getting up at the same time, going to sleep at the same time, doing your laundry at the same day, but more find something that makes you happy, or a new routine that's fun, that you enjoy, that you can look forward to, and implement that into your schedule as well. With school canceled for the year, for my kids, how can I help them deal with that loss? That you talked about crying with your own kids about their camp. What else can help? So I think this is a great question. I think we have to take it day by day. I think that we have to, with our kids, show them the balance of, on the one hand, as I said before, showing them, assuming you are, how lucky you are, what you have, what they have, that they still have a roof over their heads, that they still have food, that they still have family. And then at the same time, acknowledge this is a loss. And for kids that age, camp is huge, school is huge, graduation, prom, whatever it might be that they're missing, just being with their friends, those are really important. And I think just validating it and listening to them and letting them talk about their feelings can be very helpful. And then in the next step, finding something for them to do that can keep them occupied, or you can do together. So, your summer camp plans were canceled. What can we do as a family? It won't replace camp, but what can we do? Can we clean up our backyard and make it a nice place to sit? Can we make a plan to have a barbecue with grandma and grandpa? What can we do? What would you like to do? Is there something that you want to do that will make it more special for you? I find little things are ruining my day lately, and I'm more on edge. How can I keep little setbacks from becoming huge day killers? Good question. I think that it's very easy to get caught up in the little things. And one thing that I've noticed that has been helpful for my clients, and I've been encouraging people to do, is to keep a journal, and a journal of what we would call a gratitude journal, and be aware of what are the things that we do have that we feel grateful for. Not just the big global things, which are important, like our health and our finances and the fact that we hopefully still have a job, but the small things too. And being able to recognize those small things can outweigh the little things that you say are becoming a mood killer. So I'd like to thank you all for joining me on today's EQ&A on work-life balance. Don't forget that members in the EQ community can log in at any time to get mental health guidance during this crisis, or for any reason, 24/7, all year, in English et en français, anywhere in Canada. It's been a pleasure speaking with you today. My name is Dr. Rachel Goodman. Take care.